I am Rosalino Vázquez López, research at the Universidad Anáhuac, Mexico. My team and I appreciate the invitation to this second edition of COVID-19 International Congress. One of my lines of research that I have developed with my friend, Dr. Claudia Ferreira, and a specialist on infectious diseases, is the study of immunization strategies against SARS-CoV-2 infection. It is a pleasure for us to share today the investigation entitled Immunization against SARS-CoV-2 infection worldwide, the reality of poor countries and rich countries. Thank you.
Good afternoon. We are the research team of the Dr. Rosalino Vázquez López from the Universidad Anáhuac Norte in Mexico and the Dr. Claudia Ferreira from France. We are glad to be here. We are thankful for this opportunity to be in the second e-Congress International COVID-19. We are confirmed by Lisbeth Ortiz Ríos, Brian Emiliano Esteves Toledo, Gabriela Victoria Navarro Ortiz, Ángel de Jesús Hernández Flores, and me, Atsuira Romero Miguel. We're going to talk about immunization against SARS-CoV-2 worldwide, the reality of poor countries and rich countries. We hope you enjoy this presentation and feel free to give us some questions here in the commentaries. We will be answering all the questions that you give us, so let's start.
Approved vaccines. Some COVID-19 vaccines have been approved for human use and now they are being applied around the world to vaccinate the population. These are some of the companies. First, we have Pfizer and BioNTech. This vaccine is made based on a BNT162b2 mRNA, which is modified with lipid nanoparticles and nucleosides so it can codify a complete protein spike of the SARS-CoV-2 virus, and it has an efficiency of 95% with 2 doses. Then we have Moderna. This mRNA-1273 vaccine is made based on a lipid nanoparticle encapsulated mRNA, where it has an efficiency of 94.1% with 2 doses. Then we have 4 companies that uses attenuated adenovirus. First, we have AstraZeneca and Oxford. This vaccine uses the vector of an attenuated adenovirus that affects the chimpanzees with an efficiency of 70% with 2 doses. Then we have the Gamaleya Institute. They are responsible for the creation of the Sputnik 5. This vaccine is made of an attenuated adenovirus, AD26 and AD5, that has the gene of the coronavirus protein spike, so they can replicate. The result of this is the efficiency of 97.6% with 2 doses. Then we have CanSino Biologics. This vaccine uses the cloning vector of an attenuated adenovirus 5 that doesn't have the genes E1 and E3. It requires only 1 dose with an efficiency of 65.28% in the prevention of symptoms, 68.83% in the prevention of all illness, 90.07% in the prevention of a serious illness 20 days after the vaccination, and 95.47% in the prevention of a serious illness 14 days after the vaccination. Then Johnson & Johnson, this vaccine is made of an attenuated adenovirus, AD26, that makes the immune system produce antibodies against the spike proteins of the coronavirus. The result of this is the efficacy of 72% with 1 dose. Then we have 2 companies that uses attenuated SARS-CoV-2 virus. First, we have Sinovac. This vaccine is made of an attenuated SARS-CoV-2 virus, so the body can make antibodies against the virus. It has an efficiency of 50.4% with 2 doses. And the last one is Sinopharm. Just like Sinovac, Sinopharm is one of the 2 companies that made a vaccine made of an attenuated SARS-CoV-2 virus that can produce an immune response with an efficiency of 86% with 2 doses.
Vaccines in development. As we know, there are several COVID-19 vaccines that are being currently used, but the production and some of their features are inefficient to achieve global vaccination. Because of this, the vaccines in development might have an important role to achieve the goal. There are different types of mechanisms used on the vaccines. We have the viral vector vaccines, which use a safe virus that cannot cause disease, but serves as a platform to produce coronavirus protein to generate an immune response. The RNA and DNA vaccines, a cutting-edge approach that uses genetically engineered RNA or DNA to generate a protein that itself safely prompts an immune response. The inactivated or weakened virus vaccines, which uses a form of the virus that has been inactivated or weakened so it doesn't cause disease, but it still generates an immune response. And last but not least, we have the protein-based vaccines, which use harmless fragments of proteins or protein shells that mimic the COVID-19 virus to safely generate an immune response. As of June 15, 2021, there are 102 vaccines in clinical trial development and 185 in preclinical development. As I mentioned before, there are important features on the vaccines that need to be considered so it can be as efficient as possible. The first feature is the number of dosages needed. The less dosages needed, the more people that can be fully vaccinated. And the second feature is the storage temperature. Not all of the countries have the conditions to transport and storage vaccines that need to be on very low temperatures. This is a chart of the dosages needed and the days that have to elapse between shots for the vaccines that are currently on the clinical trial development. But there's no information yet about the temperature requirement during the transport and storage of the vaccines.
Let's talk about the importance of the situation about COVID-19 vaccines and the difficulties that have been occurring since the pandemic started. We have to be aware that the vaccines were created within a short time because of the seriousness of the illness. Although the relevance of the worldwide situation is high, we're going to be explaining the situation in Mexico. For many months, several scientists, doctors, and the Mexican government have been working on a strategy to get the most population immunized as the disease enters its critical phase. Despite the low availability of resources, they created a plan that prioritizes certain groups to assure protection and wellness of the whole population. There's currently a technical advisory group of vaccines in Mexico, made up of several experts in immunology, vaccinations, infectology, sociology, and health economics, that have been working very hard to decrease the number of deaths caused by COVID-19. The GTAB suggests the prioritization of 4 groups, sorting them by their characteristics. The first group is based on the age of the patients. The second group based on comorbidities that they might present, such as diabetes, hypertension, or HIV. The third prioritized group will be formed by children with high priority needs and disabled patients. Lastly, the behavior of the pandemic will be taken into consideration. The main concern is the population density being an important factor in the mitigation and control of the virus because of the way of transmission COVID-19 has presented. As we see here on the screen, we have 5 stages that the Mexican government have been following, including and grouping certain people, such as healthcare personnel, people over 60 years old, and they lowered the age by 9 years as the vaccinations occur. It is very important to highlight that this is the original plan that the Mexican government, along with the healthcare experts, presented. It does not mean that it's going to be accomplished for sure, but it works as a guidance and a strong plan to control the situation that not only our country, Mexico, but the whole world has been facing.
Now, we are going to talk about organizations. The biggest challenge to vaccinating the world against the coronavirus has to do with the fact that rich countries monopolize COVID-19 vaccines compared with poor countries. Along the pandemic, organizations like World Health Organization, Pan American Health Organizations, UNICEF, and others have been working in the planning of strategies of equitable distributions of the vaccines, especially the distributions of vaccines in poor countries. This is the reason why COVAX arises. COVAX is an alliance created by the French government, the European Commission, and the WHO in response to this pandemic, co-led by the Coalition of Innovations in Epidemic Preparedness, Gavi, and the WHO, together with UNICEF, to guarantee equitable access to the vaccines that are developed against the COVID-19 coronavirus. COVAX is the global access fund for COVID-19 vaccines that offers doses for at least 20% of the population of the countries and deliver them as soon as they are available to help to end the acute phase of the pandemic. In the same way, COVAX aims for 2021 to grant 2 million doses for a quarter of poor countries. The distribution scheme is led by the WHO, also involves the Global Vaccine Alliance and the Coalition for Epidemic Preparedness Innovations. But why do we need COVAX? COVAX is necessary because without it, there is a very high risk that large numbers of people in the world would not be immunized against SARS CoV-2, allowing the virus and its impact to continue without end. Thanks to COVAX, the possibilities of successfully developing COVID-19 vaccines and manufacturing them in the quantities necessary to ensure that the payment for this doesn't become an impediment to access to them. By joining COVAX, both the self-financing countries and the financed countries will have access to the briefcase of vaccines created. In addition, the self-financing countries will be granted sufficient doses to protect part of their population, and the financed countries will receive sufficient doses to vaccine 20% of its population in a long term.
We've talked about the types of vaccines, the development organizations, among other topics related with COVID-19. But now, we would like to share the Mexican government approach and actual state in order to broaden the perspective about vaccination and COVID-19. Currently, taking as a cutoff date June 2021, the total cases are 2,477,283 cases, 231,187 deaths, and 1,971,470 people recovered. In order to monitor the epidemiological risk, the Mexican government released a 4-step traffic light mode to return to the new normal, which means the reopening of the activities, green for the lowest risk and red for the highest, while yellow and orange will mean a medium risk. As you can see in this map, most of the country is on green with some exceptions. 19 states on green, 8 states on yellow, and 5 states on orange. As we've said, the Mexican government developed the National Immunization Program against SARS CoV-2 virus for the prevention of COVID-19 in Mexico, published on January 11, 2021. But before this program was developed, at the beginning of the pandemic, as the cases rose, the medical resources used to treat the patients with COVID-19 were scarce, and it seemed like the vaccine was the only way to tackle down the infection curve. Therefore, on October 8, 2020, the Mexican government made an anticipated payment of $159,876,920 for the COVAX facility that guaranteed enough vaccines in order to immunize the 20% of the Mexican population, the equivalent to 51,572,200 doses. The first shipment of the vaccines arrived to Mexico on December 23, 2020. These vaccines were provided by Pfizer-BioNTech Pharmaceutics, turning Mexico into one of the first 10 countries which started the vaccination campaign against COVID-19. Nowadays, Mexico has received 64 shipments of the COVID-19 vaccine, meaning 39,676,345 doses, including different vaccines such as Pfizer-BioNTech, AstraZeneca, Sinovac, CanSino Biologics, and the National Investigation Center of Epidemiology and Microbiology, Gamaleya, plus the ones packed at Drug Mix Laboratory here in Mexico, giving a total of 44,221,655 doses, of which 40,031,327 doses have been applied to the Mexican population. This means that 31.98% of the Mexican population has been vaccinated, meaning that the goals presented on the National Immunization Program were not accomplished. On the other hand, it's important to highlight another aspect, which is the development of Mexican vaccines against COVID-19. There are 5 vaccines being developed in Mexico by different universities and organizations, but there is a lack of a national program for vaccine development. So, the National Secretary of Exterior Relationships made a consortium with AMEXIC, which stands for Mexican Agency for the International Cooperation and Development, overseas entities, and private organizations. Nevertheless, the resources are not enough. So some projects develop donation campaigns in order to continue the preclinical trials for developing these vaccines. Although there are 5 projects in development, only a few projects have public information, which are listed as follows with some characteristic of each one. The first one is the one being developed by the Autonomous University of Querétaro. This vaccine is a recombinant protein, specifically the spike protein of COVID-19. The stage of this vaccine is a preclinical stage with animals. The second one being developed by the National Autonomous University of Mexico. The name of this vaccine is UNAM and APRP9. The stage is in phase 3. The third one is the one being developed by the Universidad Michoacana de San Nicolás Hidalgo. This type of vaccine is a recombinant protein mosaic type, which means that it could be adapted to mutations of the virus. The fourth one is the National Polytechnic Institute. This vaccine uses the nanoplasmid technology, and it's being developed in collaboration with the Gould Stefano Group and investigators of the Baja California University. A part of this vaccine is going to be manufactured in other countries, and the preclinical trials, controls, and assays will be developed in Mexico. And lastly, but not less important, is the Patria vaccine. This is a collaboration between the Avimex laboratory, the National Institute of Respiratory Disease, the Mexican Institute of Social Insurance, and the Health Department of the Mexican government. Although we can't completely say it's a Mexican-developed vaccine because they bought a license for the use of the technology provided by Medical School Mount Sinai and started the preclinical trials, and nowadays this vaccine is being tested in humans and we're expecting news for July. The type of this vaccine, it's a vector immunization.
I am Claudia Ferreira, and my mission today is to bring you up recent information about the vaccination in Europe and particularly in France. On January the 24th, 2020, in France, the first index case was recognized from a Frenchman from Chinese origins in Bordeaux. The patient has been visiting Wuhan. The same day, 2 Chinese tourists, an 80 years old man and his 50 years old daughter who stayed in Wuhan, were also detected with COVID-19 at the Bichat Hospital in Paris. By January the 28th, The European Civil Union activated a mechanism for the repatriation of European citizens. Since the 1st and the 2nd of February, 447 European citizens were repatriated from Wuhan. Unfortunately, on the 14th of February, the 80-year-old tourist died from COVID-19, making it the first death in France and in the European continent. The first cluster of COVID-19 was detected in between the 17th to the 21st of February in Mulhouse, France. In between 2,000 to 5,000 people participated in a church gathering. This was considered as a major epicenter for the diffusion of the pandemic, since over 1,000 faithfuls were contaminated there. Europe has a population of 448 million inhabitants. Official COVID-19 seropositivity in Europe was from 9.5% of the entire population, possibly up to 20%. This is because unrepresented or unreported data on COVID-19 seropositivity. Regarding to death toll, up to date, Europe accounts for 965,000 deaths, representing 0.22% of the population and 2.29% of all cases of COVID-19. Going back to France, France has a population of 66 million people. Seropositivity for COVID-19 in France is very close to the median European population. It's 8.8%, with a possibility of up to 20% for the reason named above. In terms of death toll, 110,750 deaths were recorded up to date, representing 0.17% of the entire population and 1.93% of all reported cases. At least 50% of all the European population of over 80 years old has already received its first vaccine dose, and over 30% are already fully vaccinated, for a target of 70% to receive herd immunity. In France, over 32 million people had already received its first dose, and nearly 90 million people will be fully vaccinated by the 24th of June. Thanks to all of you and the organizers for your attention. 4 vaccines are currently authorized for use in the European Union. Pfizer-BioNTech, with an efficacy to 94.5%. Moderna, another RNA messenger with an efficacy of 94%. AstraZeneca Oxford, a viral vector vaccine with an efficacy in between 60 to 70%. And the Janssen & Janssen vaccine, another viral vector with a 66% efficacy. So other vaccines are in course of evaluation under the EMA. This is the example of the Russian viral vector Sputnik V vaccine, which is under review. However, neither the UA or France have not pre-ordered this vaccine. Although not yet authorized in France and the EU, 3 other promising vaccines have been pre-ordered and are in course of evaluation in the UA. The CureVac messenger RNA vaccine, which is now in phase 2 and 3. The protein Sputnik Novavax, who is in phase 3, with an announced efficiency of 89.3%. The EU ordered 100 million doses plus 100 million doses in option, of which France will receive 50 million with another 50 million doses in option. Another vaccine, promising vaccine that is being evaluated is the viral protein vaccine from Sanofi Pasteur and GSK, who are still in phase 2 and 3, received an European pre-command of 300 million doses, of which France will be allowed 45 million.
Merci beaucoup pour votre attention. Nous apprécions le temps que vous avez pris pour écouter cette présentation et retournons à l'écouter votre question. Nous répondrons à toutes les questions dans les commentaires au Facebook. Nous sommes l'équipe de recherche du Dr Rosalino Vázquez López de la Faculté de Sciences de la Santé de l'Université Anáhuac, Mexique, et nous envoyons un salut du Mexique. Au revoir.